to be here talking to you about nightmares. I think that's something that's a really interesting and kind of overlooked topic in the realm of hypersomnia. Um, so yeah, my goal for today, I'm going to share some information about research that has been done on nightmares in central disorders of hypersomnolence, including narcolepsy and IH, although it's mostly been done in narcolepsy. And then throughout the presentation, I'm also going to have some opportunities just to have people put things in the chat so we can sort of share experiences. I think especially important for this topic, given that there isn't a lot of research. So I think it's really useful just to kind of share what people's own experiences are, and that can actually help sort of drive forward our knowledge in this area. So to start off, just want to define nightmares. You might be familiar with this. I know sometimes people will kind of confuse nightmares and night terrors, which are two separate things. So nightmares are a REM parasomnia. So they happen in REM sleep. They are defined as dreams that are extremely disturbing, extended. So that just means that they're more than just like a really brief scene. Usually there's like a story, like you can kind of remember sort of an extended amount of things happening. And they're well remembered. That's a really key criteria. So it can be the case that maybe it looks like you're having a nightmare. Maybe your partner says, "Oh, you were really restless," or you seemed upset or anxious. But if you don't remember it, then it's not technically a nightmare. Might have been something else going on, might have been some other type of parasomnia, but a nightmare is defined as a dream that you remember. Typically, nightmares also are defined as they cause an awakening. So they kind of get to this crescendo where they get really upsetting, and they get so upsetting that that wakes us up. So often people wake up feeling upset, anxious, afraid. You might have sort of physiological signs, almost like a panic attack, where maybe your heart's racing, your palms are sweating, you're out of breath, things like that. So it can be difficult to go back to sleep after a nightmare. And also you typically quickly become alert and oriented. So those are sort of the classic elements to the definition of nightmares. Now, I think we could talk about how maybe some of these things might be slightly different in hypersomnia, and we need more research to really determine that, but this is kind of typically how nightmares are defined. I'll just quickly mention, so night terrors, in case you are familiar with that term. So night terrors are also called sleep terrors. That's a non-REM parasomnia. So that happens usually in deep sleep, stage 2 or stage 3. And those people don't usually remember. They have very little memory. So those are the ones, they're more common in childhood. That's where you might be screaming and you look like you're terrified. You can have those physiological signs of distress. And it's very terrifying to people around you, but you might have no memory of it or just very little memory. So it's usually not a lot of dreaming that goes along with that. So those to someone outside can look kind of similar to nightmares, but to the person experiencing it's a different experience. So that's what night terrors are. So I want to share this information about parasomnia prevalence from this great study that came out a few years ago, that actually really spurred my interest in this topic when I saw this data on how frequent nightmares are. So in this study, they had hundreds of people who had either narcolepsy or IH. So the bars in here, the red bar is narcolepsy type 1, and then the orange is narcolepsy type 2, and then this kind of yellow gold color is IH. So they were finding out how whether people had had these different parasomnias in just the prior year. So you can see for all of these, it's usually more common in narcolepsy type 1. So nightmares were the most common parasomnia. So between 80 to 86% of people reported having at least one nightmare in the last year. And then I think that's really interesting because compared to some other parasomnias like hallucinations and sleep paralysis, which we call part of the narcolepsy pentad, right? We kind of think of those as like core to narcolepsy. Those weren't as common. They still happened a lot. About half of people in narcolepsy type 1 had them, but they weren't nearly as common as nightmares. So again, this is just whether you had it at all in the last year. And then they also looked at REM behavior disorder, which is where people are acting out their dreams. So again, more common in narcolepsy type 1. Very few people with IH had that. And then sleep-related eating, which that's another non-REM parasomnia. So that wasn't too common. So I think I took the numbers from this paper and put this in a graph because I think when you see this visually, this is really striking, right? Just to see how many people were having nightmares. And so I think there's maybe a few different ways this could be interpreted. One might be, well, maybe nightmares really are more common than these other parasomnias. Maybe it's that medications people are taking for hypersomnia, maybe those are causing more nightmares, or maybe it's that medications people are taking, maybe they do help some of these other symptoms, but maybe they're not helping nightmares as much. So it's hard to say, like, are they truly more common, or maybe this is, maybe there's more nightmares because they're not being addressed as well as some of these other symptoms by certain medications. We just don't know. I think there's a few different hypotheses. But I think for whatever the reason, there are a lot of people having nightmares in both narcolepsy and in IH. So I wanted to move then, this will be our only sort of poll question. You can either use your phone to use your camera pointed at the QR code to open this up, or we can you can open that link in your browser. Okay, let's take a look at what we got so far. Okay, 90% of people said they've had any nightmares in the last year. Okay, almost everybody. In the last month, about 50-50. Okay, a little more people said no. And then what about in the last week? So 32% said they've had a nightmare in the last week. Okay, all right. Yeah, so a lot of nightmares going on here. Thank you for filling that out. And then for some other slides throughout this, I'll have some questions that'll be in the slides, and I'll ask you to just go ahead and type your answers in the chat so we can sort of read it and share. So, and I asked about this time frame. So that study looked at how many people had had nightmares in the last year. They also looked at in the last week. So in the last week is kind of what's usually used to define nightmare disorder. So this slide is about the prevalence of nightmare disorder. So not just any nightmares, but this is usually defined as having at least one nightmare per week. That's kind of the cutoff that gets used for sort of clinical significance. So if we look at just the general population, that's about 5% of people, which I think that's still a lot. That's 1 in 20 people. So this is pretty common just among just kind of general population. It's most common in people who have experienced trauma or PTSD. So people who have PTSD, it's about 70%. Nightmares are a symptom of PTSD. They're very common. So in the sleep clinic, that tends to be a lot of what we see when it's nightmares is people that have trauma-related nightmares, and that's what most of the research has been done on. But that study that I just showed you, and then a couple of others, both found that in people with narcolepsy, about 30 to 40% of people have nightmare disorder. They're having at least one nightmare a week. So that's a lot of people. And then just one study looked at idiopathic hypersomnia. So they had 28%. So it was around the same amount as people with narcolepsy type 2, which isn't too surprising. So I think this, yeah, just highlights that this is common, right? So not just having one nightmare in the last year, but a lot of people are having at least a nightmare every week. And when you're having them that often, it has the potential to really be distressing, to really disrupt your sleep and have some negative daytime effects. So let's talk about those. What's the impact of nightmares? There's a nighttime effect, and then there's also daytime effects. I've just listed some of the more common things here. So at nighttime, it could be causing awakenings, and especially if you have narcolepsy, you already have really disrupted sleep. We don't need anything causing any more awakenings. It could cause difficulty returning to sleep because you're feeling anxious and afraid. For some people, it also can cause trouble going to sleep at the beginning of the night. You might start to develop some anxiety about bedtime, be afraid to go to sleep, or even just avoid sleeping because the nightmares can be so terrifying. And I've had this even with a patient that I worked with who had narcolepsy, who was very sleepy, but tried to avoid sleeping because of nightmares and sleep paralysis, right? They can be really terrifying. So those are the nighttime effects. Daytime effects can include increased daytime sleepiness. If you're avoiding sleep or if you're awake a lot because of them, it can really have negative effects on your mood. That could be anxiety, sadness, irritability. It could also be shame. Some people feel ashamed or embarrassed about their nightmares, or maybe ashamed about the things they're having dreams about. And then you can also have kind of these intrusive thoughts about the dream content. Maybe you have sort of images that keep popping into your mind about the dream. You keep thinking about it sort of all day or all week, and that can be really distressing that you just keep thinking about it. So that's a thing that can happen during the day. I want to share just a few quotes from participants in the pilot study that I did that I'm going to talk a little bit about, but just to share sort of some of their experiences. So this one first participant said, I've always felt really dumb being affected by a nightmare. For a week, I'll be having flashbacks to the nightmare and I always felt silly. Another person just said nightmares make everything else worse. So they kind of meant just like all their other symptoms, everything gets worse when they have nightmares. Another person said nightmares are one of my most debilitating symptoms. So these are all folks who have narcolepsy who said these things. So I want to take a moment to give you a chance to put into the chat how do nightmares impact you? It might be some of these things that I've already mentioned, or it might be other things. So feel free to share how they impact you in terms of daytime, nighttime, your other symptoms. Feel free to just share in the chat if you would like. And Matt will be looking at those and can highlight some out loud, but we can read along to what everybody's saying.
Definitely have some acknowledgement of some of the challenges that nightmares present, and then some of the content that folks have been experiencing. Um, Shelley says that she usually can't fall back to sleep. If they're about someone I know, it can cause anxiety until the check-in. Um,
Mm-hmm.
and I get that a lot. Sometimes I'll have to get up and get out of bed and do a walkabout, for both nightmares and, kind of the sister symptom of hypnagogic or hypnopompic hallucinations. Like, neither one of them are pleasant, but the idea of jumping back into that nightmare, can be something I really want to avoid.
Yeah, absolutely. Yeah, it's common that people will intentionally keep themselves awake for a certain amount of time. They've kind of learned over time, got to keep myself awake for like 5 minutes, 10 minutes, otherwise I'll go back into the nightmare. That's a common thing people will do. And that might be harder if you have hypersomnia to keep yourself awake intentionally.
Looks like we have some acknowledgement for a few hours or through the next day. Nightmares can kind of cast shadows over their day.
Mm.
See a comment about emotional dysregulated
Yeah.
experiences the next day, particularly if it was distressing.
Yeah, someone said the images haunt me in the day. Yeah, I think that's a common thing. That's part of this definition where you remember them well and it can be hard to shake them, right? Because also, especially in narcolepsy, dreams can be so vivid and realistic that I think that may happen even more with people that have, especially narcolepsy. Any other comments you want to highlight, Matt, before we move
Um,
on?
no, just the impact of sleepiness the next day has kind of popped up a few times there too as well. So just wanted to call that out. There's just that
Mhm.
disrupted nature on top of potentially DNS if you have narcolepsy, but really seems to be impacting that next day functioning as well. So
Yeah. Yeah. Thanks everybody for sharing. You can continue to put things in the chat if you want as I'm talking, but for the sake of time, I'll move on to the next slide here. So, okay, when we look at sort of the sleep medicine literature, nightmares typically get spoken about as being either trauma related or idiopathic. Those are the kind of two types that get talked about and recognized. I think that there's more types than that. We just need to research them more. So I wrote this letter to the editor that got published last year where I really laid out some arguments for why I think I focused on narcolepsy just to make it a little more specific. And I think it's a little bit easier to make a case for why those might be sort of based in the physiology of the disorder. But we know nightmares are also common in IH. So I propose this idea that really we should start calling these narcolepsy related nightmares. I also think there's probably RBD related nightmares, people that have dream enactment usually have really violent dreams that are based in the neurological basis of that disorder. So, we just aren't using these terms yet, but I think this is something that the field should move toward doing because I think if you have narcolepsy, which we know is characterized by a lot of REM disruption that causes sleep paralysis and hallucinations, I don't think those nightmares are idiopathic, right? It seems like it's based in that REM disruption of narcolepsy, right? We wouldn't call the sleep paralysis idiopathic. We think of it as part of the narcolepsy. So I really think these nightmares should be thought of as narcolepsy related. Now, you can also have a history of trauma. So maybe you could have trauma related nightmares and have narcolepsy, or maybe you have a mixture. Maybe some it's trauma related, maybe it's not completely, maybe some things from the narcolepsy exacerbate it, right? So it's not always one or the other. But I think having some new terms would be useful just to really open up kind of what we're researching. So some things I laid out in that paper, like I mentioned, this idea that this REM disruption that causes these other symptoms that's already been proposed in other papers before me that seems like that could be the cause for the nightmares as well, and these symptoms can go together. So it makes sense that kind of the physiology, at least from what we know about in narcolepsy, right, this REM disruption and these other symptoms are not as common in IH. But there's also could be other sort of more indirect ways. So there could be just the stress of having narcolepsy or IH. And I added this here just that this, so these three kind of here would apply more to IH as well, right? So the stress of having the condition, stress can contribute to nightmares. Comorbidities that are more common in these conditions, so anxiety, depression, PTSD, those could all contribute to nightmares. Sleep apnea is also more common in people with CDH, so sleep apnea also can cause or exacerbate nightmares. So there's potentially some different mechanisms here. Some of it might be sort of the physiology of the condition, some of it might be sort of associated comorbidities. But I think these are things just that need to be researched more. So narcolepsy-related nightmares, I think just overall we can say these are common, but they're generally overlooked. And this is also just true of nightmares in general. There's research showing that just in general, healthcare providers don't tend to ask about nightmares and patients don't tend to mention them. I think sometimes that even happens in sleep clinics, but this is true just of any kind of nightmares. And there's different reasons for that why it doesn't get brought up. I think even most healthcare providers outside of sleep medicine don't know there's treatment for it. Patients don't know there's treatment for it. So like, why would you bring up this symptom if there's nothing can be done about it? They can also be embarrassing. Some people, like as an adult, they're embarrassed that they have nightmares, so they don't want to bring it up. Or also a thing that I hear quite commonly is just, well, everybody has these, and they're actually surprised to learn that no, most of their friends and family aren't having nightmares every week. Some people do, right? It is pretty common, but it's not a thing that most people are experiencing. But some people just think, oh, everybody has this, and they don't even realize, just doesn't get talked about. So people don't realize that it's not a thing that everyone has. It's not a thing that you just have to live with, right? You can bring it up and address it. I just have another quote here from one of my participants who described it as, nightmares are my most distressing symptom that hasn't been addressed by medication. So again, this was someone with narcolepsy who other symptoms had been improved, but their nightmares were something that were really bothering them and that hadn't improved with the medication they were taking. So in research, narcolepsy-related nightmares just haven't been researched. So I looked at all the medication trials I could find for narcolepsy and IH, and from what I can tell, none of them are even assessing nightmares. So it's obviously not a primary outcome, but they're not even assessing it in any way to look at it as like a secondary outcome. So for all the medications that we have now, we don't have data on do they help nightmares, because they're just not including that in any of their study measures. So there's just so far one behavioral treatment study, which is the pilot study I published last year that I'm going to talk a little bit about. So we clearly need more research on potential treatment, right? So we have quite a few medications now. It'd be nice to know if any of those help nightmares, but we just don't have that data. So another question I wanted to pose to you all is just what your experience has been as a patient. So thinking about the fact that this doesn't necessarily get brought up even in a sleep clinic. So I'm curious, have you been asked about nightmares by your sleep provider? Have you brought it up? If you brought it up, how did it go? Because I've heard some stories from people about like their nightmares kind of being overlooked. Like sometimes their doctor doesn't understand how bothersome it really is, and it kind of gets sidelined. So just curious if anyone has thoughts to share, or if you've had a really good experience, if you brought up nightmares to your sleep doctor, just any experiences you want to share that we can learn from each other. So again, feel free to drop something in the chat and we can look at that together. So a couple of people saying it's never been brought up. So someone whose spouse has some violent dream enactment can cause injury. Providers frequently seem annoyed when I attend appointments and try to discuss it. Yeah, that's really unfortunate. That's a big deal. That's affecting both of you and is potentially a safety concern. That should be something that, should be really important on the radar of any physician, right? That's safety is always the biggest thing. Whenever I have someone that has dream enactment or sleepwalking, we always want to make sure they're safe and do whatever we can to make sure that they're safe. Matt said he's brought it up with his physician, but not the other way around. When I brought it up, it's dismissed as anxiety. Yeah, someone mentioned that they just thought it was normal, but their friend encouraged them to see a neurologist. Yeah, someone said they don't really talk about it with their sleep doctor. It doesn't happen often enough to prioritize it. Yeah, I think this is going to vary person to person, right? Sometimes there also may be much bigger fish to fry. Sometimes we really need to just focus on helping you be less sleepy during the day. That's our number one concern, or we need to help get your cataplexy under control. So nightmares may not be the first priority, but I think that's a conversation between you and your provider, right? What are your treatment priorities? Because I have heard from some people where nightmares are their number one priority, even more so than their sleepiness. So I think that's something that ideally would be a conversation with your doctor about. What do you want to prioritize? What should we be really focusing on? Because your daytime sleepiness may not be your priority, and that's important for them to know and be able to work with you on that.
Yeah.
Someone said they were newly diagnosed with IH and were asked about nightmares. Okay. He acted like he would take me off the medication. Oh, so where maybe they were thinking the medication caused it. Well, I'll move
Yeah.
on, but thank you. Thanks again, everyone, for sharing. Matt, was there anything else you wanted to highlight from the comments
No,
you said?
no, I was just to paraphrase what I mean, it seems like if we're not bringing it up, it's not being talked about back with us.
Mhm.
And I know that that's and to your broader point, if there's no medication, they're kind of trying to triage what's most important. Like, what can you treat?
I can't speak for prescribers. I'm not one, but I would guess that for some of them, it's not something they bring up because they may not know what to do if you do describe having nightmares, right? Because we don't have clinical practice guidelines about it. We don't have data that says here's what you can do. I mean, I think they can make some educated guesses. There might be some things they could try, but yeah, it's not something like you can look at the guideline for what do you do to treat someone's sleepiness, and there's guidelines of what are the recommended things to do, and we have data on that. So I think sort of the research evidence that we have can kind of guide what providers focus on because that's what they're going to feel most confident in being able to treat. Um, okay, so just to highlight some other things that have come up a little bit already, but some things that I think are unique about the narcolepsy related nightmares in particular is so you've got extremely vivid dreams and you've got all these different mixed REM and wake states. So we've talked about like paralysis and hallucinations, dream enactment, dream reality confusion is another one, or that also gets called dream delusion.
Oh,
So those are where you have this confusion about whether something really happened and may for the next day or the next week, maybe you think something really happened and you don't realize it didn't until you talk to somebody, or maybe you're unsure and you like have to check on somebody and then you realize, okay, that was a dream. So because the dreams can be so vivid and realistic, there can be that. And there's just one good study on that that showed I forget, it was like 80 something percent of people with narcolepsy type 1 have had that dream reality confusion, and a very low percentage, I think it was like 15% of people without narcolepsy have had it. So it's very common in narcolepsy. It's not that common in people without narcolepsy. I don't know about IH. I haven't seen data on that. Lucid dreaming is another thing that's also much, much more common in narcolepsy. So that's where you are aware that you're dreaming. You may be able to control the dream or not. You can have it with or without that ability to control it, but it's the lucidity is just having that awareness that you're having a dream. So all of these are kind of this like mixed sleep-wake state. One of my participants, I had this quote that I think just really captures this. She said, "I spend so much of the night unsure if I'm awake or asleep." And it's because there's these different things happening where you're in kind of these mixed states. Maybe you're in and out of sleep with that sleep disruption. It can get a little murky. And so I think that's something that is that's really unique to narcolepsy, especially. And then the nightmares can combine with any of these. And I've heard many stories about this. So, for example, people saying, I'm having a nightmare about sleep paralysis, and then I wake up into sleep paralysis. Or, like Matt was talking about earlier, the hallucinations. Maybe you're having a nightmare, and then you kind of halfway wake up, and it's sort of continuing as a hallucination, right? You're seeing it, you're kind of half asleep, or part of your brain's asleep, creating that hallucination. So, you can get these combinations of these different parasomnias with nightmares, which I think in some cases can make them even more distressing. Like imagine having a lucid nightmare where you're aware that it's a dream and you can't get out of it. That can be really terrifying and can sort of make it even worse when you sort of feel like you're trapped and you can't change it. So those are just some examples of how I've heard people describe these sort of different phenomena kind of combining and happening together. And those are things that I just don't hear with people who have sort of trauma-related nightmares or just idiopathic nightmares. They're never describing to me having these other symptoms along with their nightmares. It's usually just very clear what's sleep and what's wake. They're not having the hallucinations, sleep paralysis, all of that stuff along with it. So I really think this is something that's pretty unique to narcolepsy. Okay, so I was curious just to get your thoughts of just from your own experience and maybe talking to loved ones, how you think your nightmares might be different from people without CDH. So maybe you've talked to your partner and you realize like, oh yeah, my dreams are just way more vivid and realistic. So I put some examples, like being extremely vivid is something that's often different. being hard to distinguish dreams from reality, having nightmares at sleep onset in narcolepsy is going to be something that happens, as opposed to like trauma-related nightmares are going to tend to happen the end of the night. I've heard also like I can't stay awake, I keep going back into the nightmare. Oops. Another one that I've heard just a couple times, but I think might happen more in IH is like this sensation of like I can't wake up from my nightmare. So as opposed to it waking you up and maybe feeling like I can't wake up from it, that might be something that happens more in IH, just kind of a hunch of mine. But so yeah, I would just be curious if you all have any thoughts from what you've observed, any way you think your nightmares might be different from people you know who don't have hypersomnia. We got Shelley saying dreams are very vivid, hard to wake up enough to stay out of the nightmare. Yeah, I've definitely heard that one before with hypersomnia. Let's see. Yeah, someone else, Lisa, mentioning dreams and nightmares are extremely vivid and creative, much more than most people I've spoken with. Also, yeah, someone mentioning kind of the dream reality confusion. I have to question myself to figure out if what I remember was real or a nightmare dream. Yeah, that's a very common experience in narcolepsy. Someone mentioning they don't wake up.
Having a bed partner has been interesting because I didn't realize the frequency of some of my nightmares and outbursts related to nightmares. It wasn't until, I was remarried that I realized that this is happening a lot more frequently than what I would have guessed, in terms of prevalence. And
Mm.
um, I would have guessed maybe once or twice per week, and then I was told no, it's like more like 3 or 4 times almost every night per week. There could be on particularly rough times,
Mm.
quite a disruption. So
Yeah, yeah, that can really be different how much you as the person um, remember it yourself versus people around you. Yeah, especially things like moving, talking, yelling. That might be a lot more noticeable to people around you. You might not be waking up from it, might not remember it. Um, yeah, sometimes it's really hard to know how often things are happening unless there's someone else in the house to observe it. Um, Someone saying hyper realistic and violent. Yeah, that hyper realistic is something that I hear a lot. And yeah, someone else mentioning violence. So every single nightmare is violent, intense physical confrontation. And so I didn't mention this earlier, but with trauma-related nightmares, they're related in some way to the trauma. They may not be exactly like what happened, but they're at least thematically related. So if you experience like a violent event, it would make sense that you're going to have things with violence happening in your dreams. Sometimes with these other types of nightmares, it doesn't make sense why you're having dreams about a certain thing. You might say, I've never been in a violent situation, or I'm not a violent, angry person. Why am I having dreams like this? And it doesn't make sense. That happens in RBD too. People tend to have violent dreams. It's not a reflection of who they are as a daytime or what they've ever experienced. So I think it can be more puzzling and in some ways disturbing when it doesn't make sense where this is coming from. And you might sort of think, oh my gosh, why is my brain coming up with this? Do I have some secret desire to do this? So sometimes people get really worried that this means that there's some like deep-seated desire or suppressed something. And it doesn't mean that. It just like there's probably just some brain mechanisms that kind of create this. Violence tends to come out. That's a common theme in nightmares. So it may not be related to anything real or anything that you're even thinking about during the day. Yeah, someone else mentioning difficult to distinguish between real and a dream. So yeah, some repeated things coming up in people's comments. A lot of shared experiences here. All right, I'm going to move on to the next slide. So, okay, in terms of medication, prazosin is the medication that you might have heard of that gets recommended mostly for trauma-related nightmares, although they do sometimes try it in even nightmares that aren't trauma-related, but it tends to be most effective with trauma-related nightmares. It's a blood pressure medication, I believe, is what it was originally developed for, but was discovered that it actually seems to help with nightmares. It's kind of mixed evidence, but there's some evidence that it helps, so it has been recommended. I haven't seen any studies looking at people that have narcolepsy or IH, so I have no idea if that helps people with hypersomnia. I think that's something that would be nice to have some research on to know, does prazosin help those kind of nightmares, or maybe does it just help other types? And then most people with hypersomnia are going to be taking some kind of medications to manage their symptoms. That might be a medication at night or during the day. And as I mentioned before, we just don't know whether those are helping or hurting nightmares because they're not measuring that in any of the trials. So as of now, because there's not data, the treatment guidelines for nightmares and for hypersomnia, neither one of them mention recommendations for specifically people that have hypersomnia and nightmares. Um, so there's no prospective trials, which means like you're planning a study and you're planning ahead of time. We're going to measure nightmares and see what happens. What we do have is a little bit of retrospective data. So this is where they take people and they say, okay, you've been diagnosed with narcolepsy. What medications are you taking? Were your nightmares better or worse when you weren't taking medication? Like that's the way that one of these studies was run. So it's better than nothing, but it's not the ideal way to really answer this question. But really, it's mixed evidence. So there's a few studies that have some data like this. And interesting, the results are not super consistent. So one of them found antidepressants seemed to help. Another one found antidepressants seemed to result in more nightmares. Same thing with sodium oxybate. One study said it was helpful. One study said it wasn't. One study, they said modafinil seemed helpful, right? So it's just not really clear. One of these studies also just had people on a lot of different medications and they didn't really break it apart by which medications. They just sort of looked at, were your nightmares better or worse on or off medication? And there's a wide variety of medications people are taking, right? Including stimulants and antidepressants and sodium oxybate. So that's kind of all we have so far. Just not really good data. So really what we need is some prospective trials. We need the clinical trials that are going on now. I would love for them to all be measuring nightmares so that we can have some data on that and know whether this helps. So this is all we've got so far in terms of medication. So I did just want to stop here and just ask you all, you might have had experiences if you've got nightmares and you're taking medication. So this isn't not a time to like give each other advice, but just to share your own experience. Any medications, whether it was for narcolepsy or IH or not, it could have just been another medication. Any that have made your nightmares worse? Any that you feel like have made your nightmares better? Anecdotally in the clinic, I've heard various things. So just, yeah, anyone have any experiences you want to share or things you've heard from other friends or Matt, you said I see case studies mentions prazosin may exacerbate cataplexy. Oh, I haven't come across those. Okay. Um, yeah, yeah, obviously don't want
There's
that.
at least one. But it's old and that I just see that one, but so it may not
Mhm.
stand out. But
Okay.
for me, sodium oxybate seems to reduce the amount of dreams that I remember or can, consciously recall. And so, you know, uh, both myself and talking to other peers in the community, at least anecdotally, it seems like it may suppress some of the frequency of nightmares, or at least what we remember from those.
Hmm.
That's been something that I both heard and seem to remember. Not a huge reduction, but enough
Hmm.
that it warrants discussion.
And I think that makes sense mechanistically. So anything that reduces sleep fragmentation theoretically should help reduce nightmares. So if sodium oxybate helps your sleep become more consolidated, fewer awakenings, it would make sense that that would help. So yeah. Um, but yeah, that one study showed that it seemed to be associated with more nightmares. Um, so a couple of people saying no impact from meds. Someone saying they're prescribed prazosin, it helped early on, had to increase it. Hydroxychloroquine made someone's nightmares worse. Yeah, something that does get talked about in the literature is antidepressants for some of these other related symptoms like sleep paralysis and sleep hallucinations. So those often get used because they suppress REM, so they can help cataplexy. So that also makes sense where it might reduce nightmares if it's suppressing REM. So I don't know if anyone's had any experiences with that. Again, the data that's published so far shows mixed results.
Benadryl has been known anecdotally too to, kind of increase bad dreams, you know, both among PWN, and it's also, I'll see it pop up on Reddit sometimes about, what this happens when I take Benadryl. Um,
Mm.
Stress for me is a huge indicator. It's not medication, but sickness and what was mentioned here, or adding medications tend to have nightmares. But I know that for me, if I'm sick or not feeling well emotionally or psychologically, those, skyrocket. Um, but I don't know
Mhm.
if it's specific to meds that I might be taking, or just feeling like garbage.
Yeah, stress is a common thing that will exacerbate them. So yeah, we obviously just need more research on this because I think anecdotally we're hearing different things, but I think this would be a thing just to talk to your doctor about if you If you're starting something, if it feels like it's making your nightmares worse, or even if it makes it better, I think that's helpful information for them to have. Like, since there isn't published data, if they get even anecdotal data, if they start hearing from their patients, oh, this medication helps my nightmares, that's going to help them be a better provider. So it's worth mentioning to them, since we just don't have really published data on this yet. Okay, so I'm going to talk about behavioral treatment. So the therapy that's recommended by AASM, the American Academy of Sleep Medicine, is imagery rehearsal therapy, or IRT. And so I just have a picture here of this paper, which is the position statement that was put out in 2018. So based on the research at that time, they recommended IRT for both trauma-related and idiopathic nightmares. So again, there wasn't research on narcolepsy, so they're just kind of looking at these other types of nightmares. So I'm going to talk just a little bit about this pilot study, and when I presented the June conference, I'll probably talk a little bit more about this. So this is a pilot study to adapt that IRT for narcolepsy. We also combined it with another intervention, just to sort of get some preliminary data on this and see whether this could be effective in treating narcolepsy-related nightmares. So I'm going to give you just the kind of the high level summary of what we found. So just first of all, this is a really small pilot study. So we interpret this with caution, right? It was only 6 people. It was enough to get some preliminary evidence, but not enough to really definitively say like, oh, this definitely helps. So in this small pilot study, what we found was that there was significant improvement in nightmare frequency, nightmare severity, also in sleep talking and some other parasomnia symptoms, and improved self-efficacy for managing symptoms. So I'm just going to tell you really briefly what we did. I'm not going to get into a lot of details about the treatment, but everyone received so now we're really calling this CBTN. That's going to be sort of the new terms, just cognitive behavioral therapy for nightmares. So I'm going to use that term instead of IRT, but it's sort of the same thing. So everyone received CBTN, and then half the people also received TLR, which is targeted lucidity reactivation. And this is a procedure that we did in the sleep lab to try to help induce lucid dreaming and lucid dream control before people took a daytime nap. So trying to see, can we help induce lucid dreaming as a strategy for helping people to control their dreams? The CBTN included 6 sessions, which were conducted via video conference. These are the core components of the treatment. So there's just education about sleep, dreams, nightmares, narcolepsy. We talk about sleep habits. So these are all trying to address different factors that can feed into nightmares. So some of the habits we have can influence whether or not we have nightmares. We talked about grounding as a strategy to use when you wake up from nightmares, so ways to kind of calm yourself down. Relaxation training at bedtime, because as I was mentioning, stress can increase nightmares. So going to bed feeling more relaxed tends to help reduce nightmares. And then this kind of core strategy is that what we call nightmare rescripting and imagery rehearsal. And that's essentially, we're taking a nightmare, sort of a recurring nightmare, and we're literally rewriting it. And we sort of have some systematic ways we do that, but helping you to rewrite it in a way that feels better and eliminates the negative elements. And then imagery rehearsal means you're practicing visualizing that. So we're sort of trying to help kind of overwrite that story that your brain has become kind of stuck on. These nightmares often just become habitual and our brains kind of get stuck in them. So we're trying to practice this new imagery to help your brain sort of shift gears and go down a different path and have a different dream. So that's kind of my very quick overview of CBTN. And then this targeted lucidity reactivation, all I'm going to sort of say about this is basically the gist of it is we're using sound cues to help sort of trigger things. So what we're doing is when people are awake, we're sort of training them to associate certain sound cues with having a lucid state of mind and associating sound cues with the desired dream. And then when the person's asleep, we're playing those sound cues because when we're asleep, our brains can still pick that up and perceive it. And so we're played sound cues when people were asleep to help trigger them to become lucid and to trigger them to think about or have that desired dream. So that's all I'm going to get to about it for now, just for the sake of time. But you can read the paper if you want more details on that. So the main result here, so this is sort of our main outcome, this disturbing dream and nightmare severity index. 4 out of the 6 were at the post-treatment were below this nightmare disorder cutoff, and one of them was just a little bit above it. So 2/3 of people were sort of no longer having nightmare disorder by the end of treatment. Here's the number of these symptoms that people were having, so their weekly average. So before treatment, this is just overall the people. So about 8.5 nightmares per week, down to about 2.5 per week at post-treatment. Sleep talking episodes went from 7 to 0.5 per week. So those were statistically significant. And then the sleep paralysis, hallucinations, and dream enactment also went down, but those weren't statistically significant. So it's not necessarily a reliable finding. So gives us some preliminary data though that, okay, maybe at least the nightmares go down, possibly some other parasomnia symptoms. And then we did some exit interviews at the end just to really get people's perspective on what they experienced. And that's where some of the quotes have come from that I've shared already. That the main themes from that was people felt like they had more ability to control their nightmares and manage them. They had less anxiety about sleep, which I think is really important. So one person said, my quality of sleep has improved exponentially. I'm not as afraid now of having nightmares. I have a way of handling it. I'm not anxious about going to sleep. Another person said, I feel less anxious and ashamed about my sleep. Someone said they're waking up less throughout the night. So it's just a kind of a smattering of what some of the people reported that they experienced with the treatment. And so I'll want to let you know, haven't started this study yet. So actually I transitioned from Northwestern University to University of Utah, just starting in January. So that's why this study has been delayed, waiting for IRB approval, and then we'll be starting recruitment soon, hopefully. But this is basically going to be a continuation, sort of building on that prior study, doing a bigger study. Everyone's going to get CBTN. We're going to be doing the treatment again through telehealth. So you can be anywhere in the US. You just need to have nightmares and a diagnosis of narcolepsy, and then you're eligible to go through the screening process. So not open yet, but hopefully we'll get approved soon, and then we'll be able to start getting people into the study to receive this CBTN treatment. So this will give us a larger group of participants so we can see more clearly how effective this treatment is. In the future, I want to also do research on IH. So like I talked about before, nightmares are also common in IH. Anecdotally, CBTN seems to work. I've done this with a handful of people just in my clinic. I haven't done any research on it, but it has been successful just with people that I've worked with in my clinic. So this is another thing where I would love to do some research to actually get data on this and learn more about whether this treatment helps and just kind of maybe how the characteristics of nightmares in IH might be different. That's something that really hasn't been researched at all yet. So I want to finish here with just some recommendations, some things that maybe you can take from this. So I think number one is to I should say tell your sleep provider about your nightmares. So if you're having nightmares, if they haven't brought it up already, or maybe they have, but it kind of got sidelined, they never addressed it, bring it up. And one piece of advice is to make sure that they know these are nightmares, not just vivid dreams. I've spoken with some people where I think their provider kind of misinterpreted what they were saying. So because they might say, oh yeah, everyone has vivid dreams in narcolepsy. And so be clear, these are nightmares. These are really terrifying. They're waking me up. Like make sure they know it's not just vivid, these are nightmares, and tell them how it's negatively affecting you. Because if you want them to prioritize this, make sure they know how it's affecting you. So is this waking you up? Are you feeling more sleepy because of them? Is your mood worse? Or maybe you're afraid to go to sleep, right? That's important information for them to be able to understand why this is important to you, why you want to see if you can find some way to address it. So I think that's just something that you might keep in mind about communicating this to your doctor if it's something that's bothering you. Another recommendation is just that addressing some of these comorbidities can help. So we talked about stress tends to make nightmares worse. So managing stress, or that may be like even an anxiety disorder. So might be seeking treatment for something like anxiety, depression, PTSD. That could certainly help nightmares. If you have sleep apnea, treating that could also help. So talk to your sleep provider about that and get that treated because that fragmentation that comes from sleep apnea can cause or exacerbate nightmares. So get that addressed and that might help. And then I wanted to just, my last question here for you all is just if you all have any other recommendations for each other about even just strategies that have helped you with your nightmares, or if you have any tips for communicating about that with your sleep doctor. If anyone has any thoughts, feel free to drop those in the chat.
I would be very excited to explore some of the lucid dreaming, concepts, and I know that there's some research to suggest that lucid dreaming and narcolepsy may be, have a little higher prevalence than the general population, and I think that could be a very interesting tool. And as anybody knows me knows, I'm excited about any more dialogue and research on the topic of narcolepsy and IH, and so I'm very encouraged to see kind of where this goes.
Mhm. And yeah, my last slide is just questions or discussions. So if you can feel free to put in suggestions or feel free to put in the chat just any questions that you would like for me to address or anything to discuss.
Someone made a nice suggestion about, temperature control, which I think can have a positive impact on sleep health, or, sleep hygiene. Although I don't really love that term, but in terms of making sure that you have a productive sleep environment.
Mhm. Yeah, you might notice for yourself sometimes those things with your sleep environment or just sort of those bedtime sleep habits can make a difference. Sleep deprivation also tends to make nightmares worse. So, I know that's a tricky question when we're talking about hypersomnia, but aiming to get, whatever quote enough sleep is for you, but that, that's where sort of avoiding sleep and nightmares can sort of get you into a vicious cycle.
I do, and it's a kind of a hot button topic, but there's so much stress going on, across the country in terms of, politics, and we'll steer clear of that aspect. But, I know there's been some research about election stress impacting sleep for the general population. But, you know, Dr. Mundt, do you have any suggestions for, how to maybe mitigate some of that stress? I mean, obviously we can't eliminate it. It's, news is pervasive, but any strategies that could be helpful for kind of navigating some of the worst of that?
Yeah, I mean, I guess first of all, I always just emphasize that it's normal that we all experience stress and it's normal that that affects our sleep, right? This results in insomnia, it can result in upsetting dreams. And part of that is just life. That's normal and that's going to happen. So we do what we can. And that might mean just being mindful of your routines. I talk to people about like having a news curfew. Don't be consuming news too close to bedtime if that's something that gets you feeling anxious or upset, right? Varies person to person, but for most people it does. So being mindful of carving out that time where you're really winding down, doing things that are relaxing, whatever that is for you, right? Could be activities, it could be doing some formal relaxation exercises, could be taking a bath, but giving yourself that time to wind down where you're sort of giving yourself, trying to create a buffer between the day. It may also be daytime activities. There might be things you do during the day that really help you with stress. So maybe that's exercising regularly or making sure you're talking to friends or going to therapy. So just being mindful of kind of just in general, what are those things that help you manage stress, right? You do the best you can. Yeah, it's tough though. We can't always fully mitigate it. So you do what you can. Someone said that it's helped them to imagine the dream scenario and changing the parts of the dream I don't like. Yeah, that's actually really similar to what the therapy is. So that's really cool that you've kind of hit upon that on your own. Yeah, it's really powerful to re-envision it and reimagine it. So that's great that you're already doing that. Yeah, someone mentioned exercise, support group, and bedtime buffer work well for them. Yeah, I like that idea of having a buffer zone and whatever that needs to look like for you. But that time to slow down and wind down, setting aside anything productive, anything too stimulating or potentially upsetting. It's a hard balance. I talk to a lot of people who um, sort of describes themselves as news junkies and they feel like they need to be really informed, and that's hard. And honestly, everyone has to make that decision for themselves. It's okay to be informed, but you have to draw the line of where does that start to really have a negative effect on your own well-being, your sleep, and where do you need to draw that line for yourself? And that I think that's a really personal decision. But if it feels okay to kind of have a news curfew, cut things off earlier before bed, I think that's always helpful. One said, I've embraced what happens in my dreams. If I see deceased family, then I use it as a way that they are reaching or trying to reach out to me instead of being freaked out over it. Yeah, so kind of reframing how you're thinking about it, how you're interpreting it. Yeah, that can definitely be helpful. I don't know if Matt or Claire, anyone wants to answer the question. Someone who's newly diagnosed and not getting the support they need, how do I find another sleep specialist? Do you have suggestions for that?
Um, we don't recommend individual sleep specialists. There's the AASM has a really good platform that you can reach out and find a board certified fellow and within AASM. There's some couple of backdoors that we can discuss in breakout groups that might help you find someone who we can confirm has, patients with IH or patients with narcolepsy. There's some search tools that are available for that. And then, the the SBSM has a find a provider. So if you're looking for a behavioral sleep specialist, and that was going to be one of my final questions, Jen, is, are some of these things, do you need to see a specialist in sleep, or are these some things that, a practitioner could apply, with, just some education and following the different guidelines? Because I know
Well,
there's some very big resource deserts when it comes to behavioral sleep providers across the country. So just wanted to get kind of your suggestions, or what could it, if you have a therapist who wants to know more, what could you point them, to some research or direction that they could follow?
Well, yeah, if you're having really nightmare disorder, I would definitely find someone who is trained in treating nightmares. And it's, yeah, unfortunately not a super common thing. There are, because nightmares are really common in trauma, you might be able to find someone who treats trauma who also is trained in imagery rehearsal therapy. But yeah, your best bet is the behavioral sleep provider directory, to find someone who really has the knowledge, because it's kind of this knowledge of both the sleep, sometimes sleep and trauma, or sleep and narcolepsy and nightmares. So yeah, really finding someone who actually has training in that. I would look on the behavioral sleep directory. And now there are people who are offering telehealth even across state lines, depending on their
Yeah.
licensure. So you may be able to find like a telehealth practice, to find someone that treats nightmares. They may not be in your state, but you might be able to do telehealth with them. So I
Yeah.
think it's getting easier now for psychologists, there are some laws that allow us to see people across state lines sometimes.
Yeah.
Um,
I was going to reference PsyPact as kind of a tool. I
yeah,
think it has 38 out of 50 states. So you can find a
yeah.
provider if your state's a part of PsyPact, that you can
Mhm.
reach out and see somebody virtually. And I think that's been a tremendous um, net positive for patients in terms of finding a provider that can really meet their needs, especially in a case where it may be a little bit nuanced and harder to find someone who fully appreciates the challenges that sleep disorders present.
sorry, just real quick, Matt.
Yeah,
The
go ahead.
Hypersomnia Foundation does have a provider directory for patients as well. On my computer, the actual page is down right now, but if you go to our website and look on the menu, you can find, it's under Finding Doctors. There's a tab that says Finding Doctors, Medicines and Treatments, and there's a drop-down menu there that has an international directory of doctors that would treat IH and related sleep disorders. I would provide the link, but just on my computer, that particular link is down right now, but it's definitely on the website.
I
Uh,
put some other links there in the chat for folks who are asking questions. SciPac, to see if your state is a part of that. They have a list that you can check. I would look at the behavioral sleep. That's the SBSM, Society of Behavioral Sleep Medicine, would kind of be my go-to if you're looking for a behavioral sleep specialist that can reach out. There's some great ones out there, and as Jen will probably say, there's so many that focus on insomnia and, some of the comorbid insomnia and sleep apnea. But I think, again, if you find somebody who's focused on sleep, they can probably be very helpful here. But most importantly, that they also have that nightmare expertise as well, if that's something that you're looking to get treatment for.
And if you happen to be a therapist or know someone who is and they want treatment in that, there's now a really great resource. I'll put it in here. It's CBT Nightmares, I believe .org. So they also have a website that came out even earlier to learn CBTI, the treatment for insomnia. But so this is I think as of now, it's still free. It's like a training for if you're a licensed healthcare provider, especially if you're a therapist and you want to learn to treat nightmares. This is kind of like the initial training to learn about the treatment. You usually need some additional like consultation and ongoing to really become proficient in it. But if you're a therapist or know someone who is, this is a nice, relatively new resource for starting to get trained in treating nightmares, so that we can start to have more people that are able to do that.
Thank you, Dr. Mundt, for coming out and spending your evening with us. Truly gracious for the work that you've done for us.